was pregnant, and during my 3rd trimester I had rectal bleeding. So that was alarming. So that was the start of me talking to my doctor about the symptoms. So I had a lot of care in the maternity ward, but she had maybe thought that it was hemorrhoids, and so she had provided steroids, and then we did steroids again and again. And so then after that was very persistent. So my primary care physician had referred me to receive a colonoscopy.
So I think I met Julie in 2017. Julie was a young woman. She was 41 years old, again, a young patient. Her diagnosis was rectosigmoid colon cancer, so a tumor that is bridging this distal sigmoid colon and the top of the rectum, so about 15 centimeters from the anal verge. And she had her scans done that did not show locally metastatic disease to her liver or lungs, and that would have put her in stage 4 disease.
So I was very nervous, coming into the next doctor's appointment, but also excited to get started on a treatment plan just to kind of see how my body would respond. So Dr. Nfonsam comes through the door, and he has an entourage of other medical professionals with him. And I think they may be students, potentially. He comes very empathetic and humble, but very reassuring and honest. And so I cued off of his energy, and I felt really good after the first appointment.
We had an extensive conversation. We discussed her in a multidisciplinary tumor board and what are the best options for her.
And so when I did go through the colonoscopy, I had woken up, and the doctor had asked everyone to kind of come into the room because he suspects that this would be colorectal cancer, and kind of walked through what he might think may happen, but to wait for a pathology report.
We try to create a very supportive environment around her, and which includes communicating all our plans, what we're doing for her, and whatever support she needs. She hasn't had a recurrence, and the chance of her having a recurrence now is close to 0. So we're very happy with her outcome.
I had a really good support system, so I'm very fortunate. And Dr. Nfonsam, I remember before surgery, came and visited me and explained, the procedure, and said everything would be, be okay. And so when it was over, I actually opened up my eyes. I said, "This is easier than a C-section." So I just had a child. I'm going to be okay.